Your hip is a simple ball and socket joint. The socket of the joint is called the acetabulum. The top of your thigh bone or femur has a ball on top of it. It fits perfectly inside the socket. Now, many patients think that their hip joint is on the outside, but that's not actually true. The femur or thigh bone has a bony bump on the outside called the greater trochanter, and this is what you can feel on the outside of your hip. But that is not actually part of the hip joint. The ball and socket of your hip joint is actually located beneath your groin. If you pushed a pin through the skin of your groin, it would eventually pop into your hip joint. And this is why hip pain is commonly felt in the groin or the buttocks. Hip pain can also be referred down your thigh and even into your knee joint. Both surfaces of the ball and socket are covered in a smooth substance called articular cartilage. Now, my grandpa, back in the day, would have referred to this as gristle. You may have seen cartilage or gristle stuck to the end of a bone, such as a chicken wing. It's exactly the same substance that's in your joints. Now, this smooth articular cartilage allows your hip to glide around and move without any pain. A normal hip joint lets you move your leg in pretty much any direction, forwards, backwards, and also from side to side. These hip movements are essential for everyday activities, like doing the shopping, riding a bike, getting into and out of a car, and even putting on your shoes and socks. They all require your hip joint to move freely. The hip joint is right at the top of your entire lower limb, so every joint below also relies upon it. Otherwise, these joints have to compensate because your hip is not doing its usual job. The hip joint takes a huge amount of pressure off your lower back or lumbar spine. So if your hip is stiff and not moving properly, you may also experience worsening back pain. When the smooth articular cartilage of your hip joint wears away, it exposes the bare bone beneath. Your hip literally begins to grind bone on bone, a bit like a mortar and pestle that a chef would use to grind up spices, two very hard surfaces grinding together. Now, this process is what we commonly call arthritis. Now, arthritis is quite a complex and interesting topic in itself. So if you'd like to learn more about what causes arthritis and how it affects your joints, then take a look at my arthritis video on the education section of my website. When looking at an x-ray of a normal hip joint, we can see a clear dark space between the ball and socket. Now, that dark space is the cartilage inside the joint, which is invisible on an x-ray. When looking at an x-ray of an arthritic hip joint, we can see there is no longer any space between the ball and socket. The nice smooth contour of the joint has also changed. This is because all the cartilage has worn away and the ball and socket are now grinding together. The more bone and cartilage that grinds away, the more the ball will move deeper into the socket. This makes the entire leg shorter on that side. It's not uncommon for a patient's leg to actually be 1 to 2 centimeters shorter due to their hip arthritis. Because this shortening happens slowly over many years, most patients don't actually notice it, and they can be quite surprised when I point this out to them. An arthritic hip can be very painful, but that's only half the problem. As arthritis progresses, the hip joint also becomes very stiff, and this has a big impact on your function. Remember, you need your hip to move freely to let your lumbar spine and other joints in your lower limb do their jobs properly. And that's why hip arthritis can be so disabling. It's not just pain, the stiffness of your hip prevents you from doing a large number of activities. Some of the common problems patients report include difficulty bending down to pick things off the floor, getting into and out of a car, and especially getting dressed and pulling on their shoes and socks. Hobbies like playing golf or going for a walk are also very challenging. Pain is also a major symptom, and if severe, it can actually make everyday life quite miserable. A loss of sleep and a need to take regular pain medications is very common. If you would like to talk to me about your hip, then please ring my rooms at any time to make an appointment. If you haven't already had appropriate scans, I can arrange for these to occur before I see you.